Since our last strike, there's been no changes, no improvements, just a lot of the same understaffing and undervaluing of the critical work that you do every day.
We are over it, we're tired, we can't do it anymore. The hospital system's at capacity and the healthcare system is at breaking point.
We are having shifts where we don't go on break. We don't even go to the toilet. We are having a lot of overtime. We are overstressed, overworked, and no one is listening to us.
Give us fair patient ratios. It's easy, that's all we want.
Minister Hazzard was quoted by the ABC as saying, "We need to have enough nurses every day to make sure the nurses are not frazzled." I'm not frazzled, I'm mad as hell.
I'm disgusted that I have to be here today to fight for something that should be rightfully ours to keep our patients safe. Other states have it, it's proven to save lives and money, and yet our state government refuses to give in.
Obviously we deserve to be paid more for our clinical expertise, but it's mostly about patient safety. In ED and acute, I can have 4 patients. One can be having a non-STEMI, one can be having a stroke, one could be in a spinal collar, one could be having a hypoglycemic episode. It's not safe.
Hear us loud, Mr. Perrottet. Ratios does not destroy the bottom line, it improves it. Ratio saves lives.
On a bad day, you can have 1 to 12 for the ratio with only 1 assistant in midwifery or an enrolled nurse. These numbers are doubled in maternity because in these numbers, babies are not counted. It's not on, Dom.
We are not coping, and give us our staff ratios and the yearly pay rise that we all deserve.
We are sick of it. Sick of the excessive workloads, the overtime, the missed breaks, the rationing of care, the heartbreaking decisions, the patient we never got to. We are done.
It's not okay to have 1 nurse in the waiting room with 35 patients. It's not okay to have a 2 to 5 ratio in resus.
Having 5 staff for 31 COVID positive patients in mental health in wards that are not built for it has been absolutely horrific. We're well and truly done, and there seems to be no end in sight.
We've had at times 10 ambulances waiting to offload with no place to go. We are treating patients outside on park benches.
While we're standing here today, there are more than 20 rallies occurring across New South Wales.
From Wagga to Wollongong and everywhere in between, the message for the state government was loud and clear.
Last month's demands for better pay and mandatory patient-to-nurse ratios fell on deaf ears.
It's not safe for our patients. We can't provide the care that we used to be able to provide.
In Cowra.
We've got staff that are crying.
Orange.
I am burning out, and I'm only started my career. I'm 10 years young into nursing.
Bathurst.
Constant overtime, and we've just had enough.
And in our smaller communities too, like Canowindra.
There's only 2 people in this whole building. We don't have security guards. When someone is spitting at us and biting at us, we have to barricade ourselves in a nurse's station.
We're here to make sure that every hospital, doesn't matter where you work or where you live, is covered and supported by safe staffing.
We're tired, we're exhausted.
We're striking because we've had enough.
I think I did a 19.5-hour shift once. It's horrible.
Yeah. They don't want to know, they only want to hear the good stories. So they want management to say that they're coping, that they're within their budgets, and that there is no crisis. But we are at crisis.
This is what we're doing. We are going to keep walking off the job until we are heard and we are safe.
We are not putting up with this anymore. We will fight you to the end.
What do we want?
Ratios!
When do we want them?
Now! This is not good enough! We deserve better! We are isolated. We are unsupported. Our junior staff are scared to come to work. We are forced to make life and death decisions every single day. The government is failing us. They are failing to listen and they are failing to act.
Over the Christmas period, things got so bad at Yass Hospital, there was 2 night shifts where the whole hospital was staffed with 1 enrolled nurse who had never worked at the hospital before and 1 locum doctor who had never worked at the hospital before. How can you run a hospital like this?
We can't just walk away from a system that we see breaking. We will continue to come out here and stand up for the safety of our patients, because we don't turn our backs on the people of New South Wales like they do.
Parity, it's time to get real. Give us ratios, shift by shift, and heaven help us, do it now.